Routine outcome monitoring refers to the use of psychometric questionnaires completed by patients on a regular basis in order to monitor how they are responding to therapy. Typically, patients complete these measures at the start or before the start of therapy sessions, and therapists can make a judgment about whether their symptoms are improving or staying the same or deteriorating. Feedback refers to computerized technologies that enable us to make more accurate judgments about these measures. Computerized feedback systems classify patients as on track or not on track based on comparing the patient's symptoms to symptoms of hundreds or thousands of similar patients. Literature in this field, summarized most recently in this review published in Psychotherapy Research in 2023, indicates that the use of computerized feedback systems improves clinical outcomes and psychological treatments. Michael Lambert's team first had the idea of collecting data for thousands of patients treated in their university counseling center in order to model trajectories of change. The goal of a feedback system is to alert patients to not on track cases using risk signals that are automatically provided by a feedback system. In 2016, my research team developed expected treatment response curves, ETR curves, following the methodology proposed by Michael Lambert in the United States. This enabled us to develop the first generation of computerized feedback systems for NHS talking therapy services. We tested the effectiveness of this computerized system in 2017, indicating that the use of feedback enables you to achieve similar clinical outcomes, but in fewer sessions, therefore making therapy much more efficient. People get better sooner. If you compare the number of sessions in the control phase, so before the therapist started to use feedback, and the intervention phase, after they were trained to use feedback, the average cost of treatment was significantly lower in the feedback group. In this randomized control trial, half of the therapists were randomized to a usual care control group in NHS talking therapy services, and half of them were randomized to an intervention group. The intervention involved reviewing feedback graphs for all of their patients over the course of a year. We compared their outcomes on all of the 3 outcome measures used in these services, the PHQ-9 for depression, the GAT-7 for anxiety, and the work and social adjustment scale. The results are shown on the right side of the figure. In figure 1, you can see that the average level of depression symptoms, represented in blue, was lower, indicating better, milder after treatment, in the intervention or feedback group by comparison to the control group represented in orange. The comparison in the cases that were on track, in other words, patients that were responding to treatment in a typical way, was not statistically significant between groups. And we would expect that because patients who are on track will eventually improve and many recover without a need for additional technology. But if you see the right side of this figure 1, the difference in the post-treatment level of depression symptoms is statistically significant when you compare the feedback group and the control group in not on-track cases. This is really where the technology is intended to be most helpful. In cases that are not responding to treatment, it is much better for therapists to be alerted to this as soon as possible in order to identify and resolve problems before patients typically drop out if they're not responding well to treatment. In figure 2, you can see a different comparison, this time in the full clinical trial sample. This is a comparison of the percentage of patients who achieved reliable recovery at the end of their treatment episode in the feedback group in blue and the control group in orange. You can see that there's approximately a 10% improvement in reliable recovery for this whole clinical group in the feedback condition. More recently, we published a book to guide practitioners on what to do if their patients are not on track. And this book outlines several clinical formulation and clinical support tools that therapists can use if patients are not responding as expected to treatment. In addition, we partnered with our industry colleagues, MindLife, to develop, this is an artificial intelligence feedback system that provides expected treatment response curves. But in addition, it provides real-time predictions about the probability that a patient may recover at the end of treatment by comparing that patient's response to data from thousands of other patients treated in the NHS. We trained 17 therapists to use this AI Oracle feedback system and to apply clinical strategies described in this book. They treated 92 patients over the course of 1 year. And the comparison of outcomes is shown on the bottom of this graph. You can see all of the bars here are lower than the bars here, indicating that you get better recovery indicators using the technology by comparison to treatment without the technology. And these indicators of improvement and recovery are also higher than the similar indicators for data aggregated for all NHS talking therapy services in England. In summary, using outcome measures and computerized feedback systems is an evidence-based way to improve clinical outcomes in psychological treatments.